Hello everyone, welcome to Dr. Tuchai, and in this video we'll talk about post and core. What objectives we will cover in this video are: what is post and core, what is the purpose of post and core, what are the factors affecting post and core, indications, their contraindications, and types and advantages and disadvantages, steps of post and core. So first is, what is a post? So post, it is a restorative material that is placed in the root of a structurally damaged tooth, in which additional retention is needed for the core and coronal restoration. So we can see clearly in this picture the arrow which is indicating a post, that is a post, and core, it is above it. So core, it is a restorative material that is placed in the coronal area of the tooth. So when we provide post and core, of course, in an endodontically treated tooth. Next is, what is the purpose of post and core? Post and core, we can clearly see just look at the picture which is below it, that is showing that is a post, okay, and the next picture you can see a core. So after placing the post, we can provide effective coronal seal, and eventually we can also provide a crown to the tooth which is structurally damaged. So the purpose of post and core, it not only provides effective coronal seal, but it also protect remaining tooth structure, it replaces the missing tooth structure, it provides acceptable aesthetics, restored function, and resist occlusal forces. So the next is, when we should give post and core. That is very important. When to use a post? So first point is, when there is more than 50% of the coronal tooth structure is lost, more than 50%, okay. So in the first picture you can see that the coronal tooth structure is not like half damaged, like we can see it is 50%, but it is more than 50%. Next is, when we should provide, when the tooth is serving as abutment, and for like FPD, RPD, or overdentures. So when the tooth is serving as abutment, of course it needs more retention and stability. For FPD, RPD, or overdentures, we also can give post and core. Next is, there should be 1.5 to 2 mm of sound tooth structure present circumferentially above gingival margin. So in the picture above you can see, not the first, the second one, we can see that there is 1.5 to 2 mm sound tooth structure is present, which is an indication for post and core. And why we need it for ferrule effect, we will discuss later. So next is, there should be good apical seal, okay. And the fifth one is, there should not be any periapical infection. So in the picture we can see that a yellow arrow indicating that there is a periapical infection, and we should not give the post and core. So the contraindications are, we have already talked about, like periapical pathology or any infection, and when there is inadequate or compromised root. For example, like there is root resorption or furcation involvement, we cannot go for post and core in these cases. Next is, when there is very thin roots or poor periodontal condition like mobile tooth, or if there is root fracture is present, then we will not give post and core. Now we'll talk about the types. We already know when we should provide post and core and when we should not, and what is the purpose, why we are providing a post and core. So now we'll talk about the types. So there are different types, like customized and prefabricated. What do you mean by customized? Customized means they are not ready-made. We have to they are fabricated in the lab, and there are 2 appointments because it's lab fabrication. So in the first appointment, for the impression is taken and then it is sent to the lab for fabrication, and the second appointment is placement. So the second type of post is a prefabricated post, and a prefabricated post includes only single appointment because there is no fabrication of the post, there is only just they are ready made and we can use it, okay. And so now we'll talk about prefabricated types, because they are of different types. So we will divide the types of prefabricated post on the basis of material, like metallic, non-metallic. So metallic post, prefabricated posts are titanium, nickel chromium, cobalt chromium, stainless steel, platinum, gold, palladium. And the non-metallic are carbon fiber posts, tooth colored posts, fiber reinforced posts, ceramic or zirconia posts. In the picture below you can see the blue one, you can see below the non-metallic is fiber reinforced posts. Next is, these are also the types of prefabricated posts on the basis of design. Like the one is tapered and they are of smooth, serrated and threaded. We can see A is smooth, B is serrated and C is threaded. So they are also parallel design. They also have the same different types like smooth, but their walls are parallel. We can easily see that D is smooth parallel post, E is smooth parallel serrated post, and F is parallel threaded posts. So what is the difference between tapered and parallel is because of their walls. The walls are parallel and tapered, we can say the walls are tapered, but the design is like they are different, same, smooth, serrated and threaded. Okay, now we'll talk about, now there's a question, which type is most commonly used post and core system. So the answer is fiber reinforced post system is commonly used. Why? Because of the following reasons. Because they have similar elastic modulus as dentine and protecting root from the fracture. Thus, the bonding is used instead of cementing. It is safer to use, they can be easily removed if needed, and it provides improved fracture resistance compared to metal. We can see in this picture it is a fiber reinforced post. Okay, next is prefabricated posts. We have already know what are the types of prefabricated posts. Now we'll talk about their advantages. So are there any advantages? Of course, they are convenient to use because they do not require multiple appointments. Chairside procedure is simple and there is no lab involvement. Okay, but the disadvantage is that there is no anti-rotation feature. Why it is a disadvantage is because in case of the roots where there are curved roots, so of course anti-rotation is needed in that case. So what we will do, we will go for a customized post. Okay, we will not use the prefabricated post because it will not go to the required length we needed. Next is the root. There is also another disadvantage is like the root is modified. Why we are saying that root is modified to accept the post? Because we know that prefabricated posts are ready made. Like in case of a curved root, we have to modify the root according to the post, according to the shape of the post or design of the post, so that the root will accept the post. Okay, and in that case we have to modify, so we have to remove more root structure. Okay, we can say that. Next is there is no customization of post, like it is the same meaning like they are ready made. We cannot customize the post according to the root, so it is a big disadvantage. Next is, of course, for their customization, because there is no customization of the post and because we have to modify the root, what we will do eventually, there will be required more removal of sound root dentine for proper fit and retention, and thus there are more chances of fracture. Next is customized posts. So their advantages is that there's conservation of root structure, like we don't have to remove more root structure or we don't have to modify the root. Okay, and in case of customized post, there is no weak interface between core and post, because during the fabrication the core and the post are fabricated together, like we can see in the picture below, that is a gold we can see. Okay, next is they possess high strength and retention. So customized posts, they are mostly indicated in roots where they have large diameter oval canals. Okay, where prefabricated posts tend to fit loose. So what are the disadvantages? Of course, there is increased stresses and root fracture, longer chairside time. This technique is sensitive, and the cast posts are lab dependent. We can see in this picture below, these are customized posts, and we can also see there is the X-ray that is showing. Next is, this is very important, just note it down. There are so many factors that are affecting the post and core. So these are the factors that affect post and cores. So first one is post related and the other one is tooth related factor, and both of them are very important. While because these factors are important for retention and resistance, they play a big role. So what are the post related factors? These are length, diameter, texture, taper, cementation, and the truth related factors are remaining tooth structure and root configuration. So first we will go with the post length. So the post length should be ideal is 2/3 of root length, and there should be 4 to 5 mm apical seal. 4 to 5 mm apical seal. You can see in this picture, this first one we can see that it is a perfect, it is an ideal post length. But in the second picture you can see that it is not covering the half of the tooth. So in case of shorter posts, if the post is shorter, then what will happen? There will be more chances of root fracture. Next is post diameter. In this picture we can see, you can see 1/3, 1/3 and 1/3. So the post diameter should not exceed 1/3 of the root diameter, and the dentine present circumferentially should be 1.5 mm. Okay, minimum 1 mm. And if the post diameter is greater, what will happen? Perforation due to excessive post diameter can result. Next is post texture, another important factor. For what is post texture? Like we have already talked about, there are different types of post like designs or post texture on surface on the basis of like smooth, serrated, and threaded. So I will explain all these in terms of retention. Like a smooth post, the retention depends on the luting cement. Why? Because we will see that the post walls are smooth. There is no like serrated or there is no threaded. While in serrated post, the retention is greater. While because of the mechanical undercuts, and they will provide a greater retention, okay, for the cements. While in threaded post, they are highly retentive due to engaging walls of canal. You can see in this picture that they are threaded, and eventually they have engaging walls, and then eventually what will do? They will provide greater retention. Okay. While in serrated, you can see they have mechanical undercuts. Retention is good, but in a smooth post, the retention mainly depends on the luting cement. Okay. So next is, while I also want to say in threaded post there is a disadvantage. Why? Because they transfer greater stress to root structure and thus more chances of fracture. So they are used when maximum retention is needed. They have an advantage also. Next is post taper, another factor which is important. Like you can see there are different post taper types. Okay, parallel post, taper post, and parallel tapered post. So we will talk one by one. First is parallel post. So the parallel post, they have an advantage that they induce less stress on roots, but they have excellent retention. But the disadvantage is that less conservative at root tip. Like in the A picture you can see there is less conservative at the root tip. Why? Because they require removal of root dentine at the critical area, and thus there are more chances of root fracture. So are indicated in large canals where adequate root dentine is present. Okay. While we can see in the B picture, this is not a parallel post, but it is parallel tapered post, and it is good. Okay. Next is tapered post. So it is we can see clearly it is only a tapered post, not parallel tapered post or not a parallel post. So they have a disadvantage. They have an advantage that there is conservative around root dentine, as canals are shaped in tapered fashion. Okay, so that's good. But what their disadvantage is that they have greater chances of root fracture because of the wedging effect of the post, so lower retention value. So the third one is parallel tapered post. That is the good one. This last one is a good one because why? They are parallel, okay, but the critical part of the root tip, they are tapered, and thus they distribute forces eventually more effectively without wedging effect, and there are less chance of fracture and more retention. So now we'll talk about the luting cements. So that is used for luting the post in the canal. So there are some of them I will mention, like zinc phosphate. They are mostly used for prefabricated post. Glass ionomer for metal post. Resin modified GIC. And the fourth one is composite resin. Composite resin is mostly used for fiber reinforced. Now there is a question, which one is the best luting agent? Just remember this and just wrote it down. It is important to know. Resin cements are the best luting agents. Why? because they have the property of self-cure, dual cure due to limited light penetration into the root. Okay, next is the tooth related factors. We have talked about the post related factors that are very important for retention and resistance. Okay, now we are going to the tooth related factors. So these are the tooth related factor which is important is remaining tooth structure. Okay, or we can say the ferrule. So what is the ferrules? Ferrule, we can see, first of all, just look at the picture. Okay, look at the picture. We can see this is the picture. Just remember, before I will tell you or explain what is ferrule, just remember that ferrule is part of a crown. Okay, ferrule is not part of the tooth, it is a part of the crown. Okay, but what it is a 360-degree metal collar of the crown that is surrounding by parallel walls of the dentine. Okay, dentine is part of the tooth and extending coronally to the shoulder of the preparation. So for the ferrule effect, there should be 1.5 to 2 mm should be present. Tooth structure should be present for your restoration. For your restoration means for the crown. Okay, and it provides resistance formed by protecting teeth against fracture. So its role is to protect the teeth against fracture. And you have to remember it is part of the crown. Okay, and for its preparation, you should need 1.5 to 2 mm of coronal tooth structure. Okay, that's it. That is ferrule effect. So in this picture, you can see the blue one. Okay, we can see, or just you can see a picture beside this, that there is no ferrule effect. Like you can see, okay, there is no preparation. There is no preparation for around the tooth. There is no ferrule. While you can see the ferrule is prepared in the tooth below it. Next is tooth related factor. Another which is important is root configuration. Like in curved canals, a straight post only extend to the start of the canal curve. So it is a complication. Like there is a complication in case of these. Like we have to straighten the canal, and there is more chance of perforation, weakening of the root, and thus there may also be apical seal is lost. Okay, there is no